Even though we've discussed this topic before, I think this PowerPoint will give you more illustration in how we prevent staining, or at least try to. Many people get staining no matter what you do, but your primary objective is to keep it as minimal as possible after a sclerotherapy. Now, it's important to use the appropriate concentration of sclerosant. We normally try to use Sotradecol, since I think it causes less staining than polydocanol. However, we also use tumescent, and we use flushing. We use a lot of techniques since we try to get rid of the complexes as quickly as possible. If you do not want to do these techniques, it will take longer to get rid of spider complexes just by doing sclerotherapy alone. So normally we use Sotradecol, 0.1%, diluted with water, or polydocanol 0.33%. Now, polydocanol is non-ionic, hence it doesn't make any difference whether you dilute with normal saline or water. Using Sotradecol 0.1% diluted with water will cause acute clotting in many patients, especially if you use tumescent. This illustration shows you a patient that we're going to follow up on that had clotting about 9 days after her sclerotherapy procedure. In this case, we used foam. She had a very dense complex, and we wanted to also seal off the origin, which was the lateral reticular perforator, so we used foam, 0.1% Sotradecol foam in this case. Acute clotting is not a concern in our practice since we flush these complexes when this does occur at time of sclerotherapy. You will get faster resolution if acute clotting does occur, but you must take steps to prevent the staining from occurring after the sclerotherapy. Now notice the difference between the complex that is marked with a W, which is water, and the one with saline, which is S. You can see there's a lot more angiogenic response with the water redness or swelling of the vein, indicative of much more damage than was done with the saline alone. And we know from histological studies, which showed you before, that the damage is about 2 to 3 times greater when you dilute with water than with saline when using Sotradecol.
You can see right here a little, we're just going to flush this little tiny incision there, and one there. You can see the water coming out nicely.
Now, first step is sclerotherapy, using either liquid with tumescent, liquid alone, foam alone, or foam with tumescent. Depends on your experience and the size of the complex you're treating. Step 3, after flushing, is using local compression. And we do this with a pool noodle wrapped in cast padding. Gets secured with HEPAFLIX for 48 hours. We make this tight. There's good pressure on the treated complex, which helps prevent some refilling. After 48 hours, this pool noodle is removed, and we use Dermica cream post-treatment because of its many anti-inflammatory properties. Now, the fourth step is to see the patient, if possible, within 2 weeks before a lot of this damage becomes permanent and staining occurs. If you can see them in 2 weeks, you can actually evacuate the clot by mechanical incision, or you can also use a flush with this incisions to try to get out as much of thrombi as possible. It's very important preventing staining. And many patients, no matter what you do, will clot these large complexes.
Okay, this is about 5-6 days post-sclerotherapy using foam and tumescent. You can see the areas clotted up. I'm going to do a little tumescent. I'm going to have a 25 gauge needle in a little bit, or actually I can use an 11 blade. I'm going to just evacuate a little bit of this to make this to heal, and I'll show you in a minute. Now, just make a little nick on there. Any place you can see a little trapped blood. And just express all of it out that you can. This just makes it heal a little bit quicker and have less chance for staining.
Now, this is a patient 6 weeks post-treatment. We saw her about 6 to 8 days after her initial treatment and then did the clot evacuation. She had an excellent result. So the 4 steps that are important is use sclerotherapy. If you want fast resolution, you're going to have to use tumescent. If you use just sclerotherapy alone, it's going to take longer, and you'll still get probably some staining. So we try to get rid of it as fast as possible. So we do the sclerotherapy. Our second step after sclerotherapy is to flush anything out we can see. The third step is to apply compression. The fourth step, see the patient within a 2-week period and try to evacuate any thrombus if it is still present. But you can see in this patient there's been an excellent resolution with minimal amount of staining present.